Hi everyone, in this video I will be sharing with you my top tricks and tips for how I pass the NCLEX in 75 questions. Now, if you're watching this video, I would assume that you're familiar with what the NCLEX exam is, but just in case, it's basically the exam that you have to write to obtain your registered nursing license. I wrote the NCLEX in August of 2022. So I finished nursing school the end of July because I was in a 3-year program where the last 2 summers we went right through the summer, and my approach to it was I felt that the best thing for me to do was to just write it as soon as possible once I was done nursing school. I felt that I was ready, and that was my approach to it. I finished end of July, like I said, and then wrote it, I feel like it was August 9th that I wrote the exam, and that was the right decision for me, and I'm so happy that I did that because my nursing school, and I know from talking to friends of mine that went to different nursing schools, near the end of your degree, for your school to prep you to write the NCLEX, you will do multiple different exams that are supposed to mock or be similar to the NCLEX to help prepare you. So for me, that's why I decided, since I was preparing all throughout the summer to write several different exams with my university that were like the NCLEX, to just get it over with and write it as soon as I could. And I'm very happy that I did that. But I also have friends that took their time and took a month or took a couple months after nursing school was finished to just have that time to focus and study, and that's what worked best for them. My first tip is know yourself and do what makes you feel comfortable. There's no rush on when to write it, but I would recommend that you don't wait too far out after you finish nursing school to write it, because I think it is so beneficial that you write it closer to when you're finished nursing school, because lots of the information that you learned is going to be fresher in your mind from school, and as well, it can be more difficult once you start working to then have to study on top of a busy work schedule. 75 questions is the minimum that you can answer to pass the NCLEX, and it will continue to go on and give you more opportunities after 75 to answer enough correctly to pass the exam. So do not stress. That's one thing that a lot of my professors told me when I was in nursing school, is don't stress if you get past 75. So many of my classmates and people that I know passed the NCLEX, and I even know people that got up and answered the full question number and still passed. So go into the mindset during exam day. Don't put the expectation on yourself that you have to just answer 75 questions, because I'm a super competitive person, and I know leading up to the NCLEX, my goal was I want to pass in 75. But once I received that advice, I think that advice was so helpful, because I know if I set that expectation going into the exam, once I got to 76, if I did, I would be so flustered and thrown off, and then that can affect your ability to answer questions. So do not set any expectations on yourself that you have to finish the exam with a certain amount of questions that you've answered. So whether it be you answered 75, you answered 86, you answered 100, or you answered 145, does not matter. End of the day, if you pass the NCLEX, you pass the NCLEX. Like I mentioned, my nursing school and other ones that I'm familiar with have several different exams that are meant to prepare their nursing students to write the NCLEX. So for me, that was super helpful to make studying a priority, because it can be easy to put it off if you're like, oh, I don't have to write the NCLEX until a couple months, like I have lots of time. But it was nice to have those exams throughout the summer leading up to the NCLEX, because I was constantly refreshing material. I set a goal for myself that I knew that I wanted to write the NCLEX beginning of August, and my nursing school, we did just final clinical placement from May to the end of July. So during that time, we were just going full time into our clinical practice, and we were also meeting with a professor and another smaller group of students in our class to discuss our clinical experiences, and we were also writing like different papers during this time and different assignments, and like I said, couple final exams that were supposed to be NCLEX like. So I set the goal for myself that starting May, when I started my final clinical placement, I wanted to be doing UWorld questions every day. And originally I had set like anywhere from 25 to 50 questions, like depending on how I'm feeling. I just want to make sure that I'm answering them every day. So that would be my biggest tip, is to get through all the questions on UWorld. I can say that between May to the start of August when I did write, there definitely were days that I took off, but coming down into the final crunch of the exam, there were definitely days that I did over 50 just to make sure that I got every question answered. And I really stress the importance of UWorld gives such good explanations for questions. So if there's questions that you get wrong, or even a question you're like, yeah, I guess the answer to that, read the explanation because it is so helpful. Even on questions that I got right, if I just wanted to refresh that like concept or something about that answer, I would read because their explanation is so good. And sometimes I would even jot down little notes if I wanted to like make sure that I remembered that. So that would be a big tip that I could give you, is to not only answer the UWorld questions, but read the explanations, especially on the ones that you get wrong, and get through all of the practice questions. Continuing on with my UWorld tips is don't do a specific order. I found everybody has a different approach and what motivates them. Friends of mine in nursing school, they went through a category by category and that worked for them. But for me, I would pick different sections and do about like 10 questions in this section and then 10 in this section, and I would jump around because I found it helps keep me more focused, number one, because if I were to just do 50 questions straight of the same concept, it can get a little dry, and I think that that's not going to set you up for an accurate, true depiction of what the NCLEX is going to be like, because when you are writing your NCLEX, there's going to be questions from all over the place. So I found it was more helpful for me to study like that and not answer one category at a time, because I feel like too, it trains your brain in a different way to switch between the different concepts and categories as well. And I found that helpful for the NCLEX. Another UWorld tip is to use the practice exams. I did my first practice exam probably in June, I'm gonna say, and then I used my final one the night before my NCLEX, which I was really nervous to do because I was like, oh gosh, like if I don't get a high score or it doesn't tell me that I have a high probability of passing the NCLEX like the night before, that's really going to kill my confidence. But I'm so glad that I did, because it was able to give me like a true depiction, because I had studied so hard leading up to the NCLEX that taking it the night before was a good way to make sure that I studied properly and that I knew the knowledge. Because if I had taken it like a week before my NCLEX, it wouldn't have really gave an accurate picture of what I was going to know test day, because there's so much time in between there, and that's when you do, at least me, majority of my studying is like that, like crunch beforehand. I know myself going through nursing school, I used an iPad for my notes, and I thought this is going to be so helpful leading up to the NCLEX because I can have all my notes in one place. But please do yourself a favor and do not study your nursing school notes. It will be such a waste of time. not a waste of time, but you're going to waste so much of your valuable time that you could be doing things that are going to be so much better for studying for the NCLEX. So I like barely looked at my notes from nursing school when I was studying for the NCLEX, because the information that you are tested on in nursing school is so much more specific. So it's just going to be wasting your time, in my opinion, trying to study pages and pages and pages of super detailed things that are not really going to be asked on the NCLEX, because the NCLEX, I know from my experience writing, it is so broad. I was nervous that they were going to ask like little particular details, but they really don't. And I heard before I wrote it that it is a safety exam. It is just to make sure that you are you will be a safe practicing nurse. Not you are, because this is the exam to get your license, but it's just to make sure that you are going to be safe. And that's 100% true. The NCLEX is a safety exam, and I want you to think of it like that. It helped me, at least, to not feel so nervous about writing, because just think of it like the NCLEX is on your side. They want you to pass. They want you to be another nurse out in the healthcare system. So they are just making sure that you're going to be safe. And I felt on my NCLEX, they were not out to trick me. They were not out to get me. The questions were very straightforward, and they weren't looking for like these weird, obscure details. It was very general. And if you knew the basics and you knew the concepts, you're fine. And a little bit of common sense and you're good. What I would say is, when I would do UWorld questions, if there was a particular concept that I really didn't feel overly comfortable in my knowledge of, or I was like, wait, what is that? I wasn't sure that I knew it 100%. Then I would go back to my notes and be like, is there something here that can like help me understand this better? I also had this resource that I found really helpful as well, and it was this book. It was an NCLEX review book I got off Amazon, and I will put a picture of it in this video and I'll link it down below. This book was helpful as well, just for extra practice questions. And it was very portable, because I know studying in the summer, self-care is so important. So please remember, get outside. If it's nice outside, even if it's cold, get out for a little walk, get in a little exercise while you're studying, have healthy studying snacks, drink water. That is also huge, big tips when you're studying for your NCLEX, because you have to stay healthy. So like I had mentioned before, I was studying pretty much from May onwards till I wrote in August, because I had all these different exams through my university, but I really stepped up, and it was like my crunch time, I guess you would say, 7 days before my exam. So 7 days, then I was studying hardcore, and I was studying like all day for 7 days pretty much, and treating it like a full school day. And I would do UWorld questions in the morning, and then morning, afternoon, and then anything that I had questions on, or I didn't feel 100% confident that I knew based on my morning studying, then I would focus in on those topics and look back at my nursing school notes to see, okay, is there anything that can explain this a bit better for me? I would look up YouTube videos to listen to the concept to see if I could understand it a bit better hearing it from somebody else teaching. So Simple Nursing, Sarah RN, YouTubers like that I found really helpful. And then I will also link below Beautiful Nursing's 1 hour NCLEX review. I listened to that video, I think probably 10 times throughout all my summer studying for the different exams in the my NCLEX. And it is such a helpful video. It gives such a good general review, and I can back up that everything that she talks about in her review is so helpful and useful to know for the NCLEX for sure. Mark K, the audio tapes, listen to them. They were so helpful, and I know myself, if I'm not seeing something visually, I can get distracted and find it hard to focus. So While you're listening, make notes to make sure that you're actively engaged and actively listening. The marqués I listen to one time each, except the priority and the delegation I listened to again the night before I wrote. And I highly recommend doing that because prioritization and delegation is such an important topic for the NCLEX, and even he says himself that that is probably the most important tape, and it is so true. So I listened to that one twice, and I highly recommend listening to it the night before your exam. Also, the day before my NCLEX, I didn't really hardcore study that day. I know I mentioned like my 7 days before. My main goal of that day was to write my final practice exam on UWorld, and just in the morning before I wrote that, I just did like a little light review on anything that I felt a little unsure of. I listened to my marquee, and then I wrote that. I would say just a brief listing of things to be familiar with and be confident with for the NCLEX is know the insulin durations, their onset, their peak, know that and the differences. I would also say be familiar with your electrolytes and the different signs and symptoms of when they're off balance, as well as ABGs. Be familiar with how to do your pharmacological calculations. And as far as meds go, you don't need to memorize, from my experience, the different exact meds. You just kind of have to know the different groups that medications fall under and how that would work and the different side effects from those. So for example, just to make it clearer what I mean, like ACE inhibitors, beta blockers, for example, no beta blockers end in LOL. So when you see LOL on the end of the drug, you can recognize that that's a beta blocker and know the main side effects that beta blockers cause. I found that was the most helpful way for studying medications because it can be very overwhelming to feel like you need to know all the names of the certain medications because you don't. As long as you recognize certain endings to cue you off that this is a diuretic and I know this is how diuretics work and these are side effects of diuretics and important safety considerations to look out for with these medication groups. Because again, this is a safety exam. Key tip, if the person needs to sit down while taking the medication because if there's a fall risk, that's a safety concern. Different things like that. I feel like I need to do just a regroup of everything that I talked about in this video. So quickly, just to touch again, I would say do all of the UWorld questions. So try and map it out, how long you're going to take to study, and then divide it by the days that you have to get a brief idea of how many that you roughly need to do a day to make sure that you get them all done. And with UWorld, read the explanations, especially on the ones that you get wrong. You can also make jot notes so that you can come back and read your notes again and do your practice exams on UWorld. Get the book if you wish, the one that I talked about for extra practice questions. I found it was really helpful. Listen to the marquee tapes and listen to priority and delegation the day before your exam. Any concepts that you notice that you're having difficulty or trouble with in your UWorld questions, look up a video on YouTube for a deeper explanation to help you understand it better. And Beautiful Nursing's review. The 1 hour NCLEX review, can't recommend it highly enough, and it'll give you just a general idea of things that you should focus on. That concludes my video on NCLEX tips. I could talk about the NCLEX all day. I love talking about this stuff and sharing tips with you. So if you have any other tips or tricks that you would like me to talk about to help you get through nursing school, I would absolutely love to help in any way that I can. Leave a comment down below with any videos that you would like to see. Thank you so much for watching.